Monique Miller?
Yes, I
Okay,
am.
go right ahead.
Good afternoon, Chairman Gray, members of the committee, and council staff. My name is Monique Miller, and I am the Director of Programs for Athletes United for Social Justice, more commonly known as the Grassroots Project. Today, I am joined by two of our quintessential student athletes and also coaches for our programming, and that is Kayla Geiger and Spencer Kelly. I'm so glad that we can make it here today. It's been an extremely busy week for the Grassroots Project, and in fact, this morning we were a featured story on WTOP radio, and we hope that all of the council members and committee members can have a look at that later. Mr. Chairman, I work with the Grassroots Project by way of a fellowship with Global Health Corps, in short, GHC. GHC is a leadership development organization devoted to recruiting and training the next generation of leaders in global health equity. So as such, I am one of several fellows who shares the common belief that health is a human right. And it's that particular belief that drew me to work with the Grassroots Project. How do we ensure that youth are equipped with the knowledge and the support to make well-informed health choices? Chances are thinking outside of the box will be crucial, and it's my belief that the Grassroots Project strikes this balance. We are low cost, we have unique role models, and we use unique facilitation. We're based primarily in DC public and charter middle schools, including wards 7 and 8, and we also reach students online and in the community, such as Park Morton and Berry Farm. With mentorship at its core, our youth-led programming is fun and interactive, but most importantly, it is effective. Our student-athlete coaches are recruited and trained from Division I sports teams at American University, Georgetown, George Washington University, and Howard University. To date, we have worked with over 1,000 student-athletes, and we have reached over 5,000 students in DC. Our model is innovative and scalable. The Grassroots Project complements and supports the work of the Department of Health and HOSTA in more ways than one, most notably by engaging in HIV prevention activities and preventive health services. The Grassroots Project is poised and proud to continue our efforts in tackling teen health disparities and improving health outcomes for young people in the DC area. We look forward for the opportunity to continue working with HOSTA and the Department of Health. Thank you for the opportunity to be here today, and upon the conclusion of Spencer and Kayla's testimonies, we're available for questioning.
Thank you very much. Go right ahead.
Good afternoon, Chairman Gray, members of the committee, and council staff. My name is Spencer Kelly, and I am a sophomore at Howard University on the men's tennis team. It is a pleasure to share my experience and involvement with the Grassroots Project since my freshman year of fall 2015. Studying international business as my current major, I didn't see myself getting involved with public health issues, especially the HIV/AIDS epidemic. I was drawn to the Grassroots Project because I knew their platform was a great way to lead and educate the next generation of young individuals about the effects of their sexual health lifestyles. I identify as a student, an athlete, a leader, a bisexual, and most importantly, an educator. All of these small characteristics about myself is only the makeup towards something greater that I use to help others on a daily basis. The Grassroots Project has taught me to continually educate the youth and even myself. This past month, I taught a program at the public charter school, Meridian Academy, with 3 other Grassroots coaches. Our class was a group of 17 7th graders with so much energy and so much life. I love working with the youth because they give me an escape from my busy college life. Better yet, surrounding myself around them once a week makes me reminisce about when I was in middle school. Week by week, we went through the motions of our curriculum, making sure we were addressing the right issues at the right time. What I'd noticed, not even within the week within the program, the kids started to ask and challenge us and educate even the coaches. As Grassroots coaches, we would call these teachbacks. Working with the kids this past month has showed me how any leader or role model can impact someone else's life for the better. They respected me as their equal, and I am very proud to say that to you all. As part of the TGP, we say this short for the Grassroots Project, I understood we advocate about sexual health, awareness, and HIV/AIDS. As a young college adult, I don't see sex as a taboo issue, and I most definitely don't back down from talking about sex. But yet again, I was never taught a subject in a way TGP does it, using interactive, hands-on activities addressing certain topics about sex. Recently, I've been accepted to the part of the leadership team at the Grassroots Project, and I'm very excited to see what happens next. Even within a year and a half within this organization, I have networked with professionals and mentors who have the same mission in mind, to help and work together with the youth to educate them about such an epidemic. All in all, I love to serve a community and others that surround me on a daily basis. I hope that my legacy at the Grassroots Project serves well for generations to come, and I do believe the work and commitment that we're doing is only the beginning. Again, Chairman Gray, it was a pleasure to share, and thank you for your time.
Thank you very much, Spencer. Kayla?
Good afternoon, Chairman Gray, members of the committee, and council staff. My name is Kayla Giger, a junior on the Georgetown women's rowing team, and I'm grateful for the opportunity to share my experience as a grassroots coach with you all. My love and commitment to the Grassroots Project comes from a very honest place, grounded in the giddy excitement I felt leaving my first day of what we call athletes to coaches training. The curriculum is not only genuinely fun, but it is also so important. It is important for the kids, but also for the student athletes. Recently, I was offered and accepted a position on the Grassroots Project's leadership team. Grassroots has been such a worthwhile organization to be involved in since my freshman year at Georgetown, and I look forward to the opportunities and community impacts waiting to be realized in my future here. While with the organization, I have been afforded countless opportunities for professional development, including planning, program development, logistics, as well as writing and delivering this testimony. In the future, I look forward to taking advantage of opportunities to do some grant writing and fundraising for the organization. The athlete development side of the organization is certainly impressive, but the heart of the program is definitely in the classroom. From teaching programs and housing projects and community centers, to piloting the all-girls program, to small one-day programs with younger kids, I have been blessed with countless mind-expanding opportunities while delivering curriculum that empowers young people to be change agents in their own lives and communities. Program impacts have certainly contributed to the district-wide collaboration amongst public health actors to reduce HIV/AIDS infections in the district. Ultimately, significant evidence indicates we have been successful in tipping the needle on this issue. That fact is certainly meaningful, rewarding, and ultimately quite motivating. However, everyday impacts of children running up from past programs, meeting graduates of the program now studying public health in college, and just day-to-day teaching moments in the classroom are plenty remarkable. Studying health policy at Georgetown, I have come to appreciate the value of health education as a method of prevention and cost containment. Working at Grassroots is a dream because it is not only an extremely lean nonprofit organization, but it also targets the low-hanging fruit of the healthcare system, early education, and prevention. Countless research articles have revealed that prevention is a profitable investment both in terms of dollars and health outcomes. For these reasons, I am particularly proud to work for an organization that works together with the DC Department of Health and its many partners to improve the health of the district. Thank you for your time and attention.
Thank you very much. I appreciate it.